Thrombi not only may arise from the veins of the lower extremities, also from the iliac veins, the hypogastric system, which is difficult to evaluate, the inferior vena cava, but also can come from the right side of the heart, particularly in individuals who have atrial fibrillation, any type of cardiac arrhythmias, particularly atrial fibrillation, or there is congestive heart failure with stasis of blood in the heart. Echocardiography is then utilized to rule out the possibility of a thrombus in the right side of the heart. In this case, note to your left, evidence of a thrombus in the right atrium. To your right, we can see a large thrombus that moves from the right atrium to the inferior vena cava. This patient had intracavitary thrombi in the right side of the heart, and it was complicated with multiple pulmonary emboli. Favorite sites for thrombosis are the auricular appendages. To your right, we can see signs of pulmonary hypertension and a mass in the right ventricle. So echocardiography not only may reveal the presence of a thrombus in the right side of the heart, but will confirm the clinical impression of precapillary pulmonary hypertension. I did this study in a very obese lady who had evidence of pulmonary emboli. Contrast was injected in the superior vena cava, and the position of the patient was a prone right anterior oblique. Note the lack of visualization of the right auricular appendage. We could not see filling defects in the right atrium or right ventricle. The lack of filling of the right auricular appendage was an indirect sign that this might have been the site of the pulmonary emboli. At autopsy, the right auricular appendage was found to be filled with old and new thrombi.